Well, I was one of those people who knew from very early on that I wanted to be a nurse. My grandmother was a nurse, and I knew that I wanted to help people in some way.
It was an epiphany in my senior year of high school that I woke up one day and realized that I wanted to be a nurse, and I've never looked back. It was the best decision I made.
Well, the nurse is the one that's at the patient's bedside, and they're responsible for 24-hour care if they're in an acute care setting. And so really they are the eyes and the ears and the hands of healthcare.
I see nurses as one of the core provider groups in the whole healthcare system.
I'm excited to be a nurse because I just think it's a really exciting time to be a nurse with all of the changes that are happening to the profession. And I think that there's so much potential in this profession and so many different things that you can do with it. So I'm starting as a critical care nurse, and then I can be a certified critical care nurse, and then I can be an advanced practice nurse, then I can be in leadership. There's just so many routes to go and so many opportunities.
I've worked in a number of different roles. Inpatient, I had the opportunity to go to the Peace Corps to South Africa and do a lot of interesting work there. So I really think when people say that nursing is a calling, I really believe that.
Oh, I can tell you that it's very rewarding to help patients, especially when they are getting better, and then to be able to function and be able to back to their normal routines, and they were able to do things they like. It's really rewarding feeling to me as a nurse.
As I have been a member of this profession for now a number of years, I've seen and learned and have grown from those experiences in ways that I never imagined possible. So the research possibilities, the teaching possibilities, the various ways to positively help people and influence the care of our citizens has just been an incredible journey.
You know, I have been a nurse for a good number of years. Actually, I'm a graduate from Pittsburgh State and continued my education, and so I always promote students. In fact, I'm in a educational setting, and so I promote my students to start out with that associate's degree and to move right up on in with the progression of nursing across the state. That's important because the education of nurses, we are there to protect the public and to help maintain the patient safety. That when you're looking at your role as a nurse, that educational development crosses your lifespan.
You know, I started out as a Bachelor of Science degree nurse, and since then have added 2 master's degrees. Nursing has been very good to me. Had really almost 36-year career in nursing right now. And I could have stopped with the BSN and could have continued at that level, providing what I would consider excellent care. But the additional degrees has opened new doors for me, has really broadened my perspective on nursing practice, and has made me more of a professional.